This is Matt Rosen, and this is The Grit Mindset with me, your host, Matt Rosen. The mission of The Grit Mindset is to inspire and empower our listeners by delving deep into the journeys of those who have faced significant challenges and emerged stronger. Through authentic conversations, we uncover the mindsets, strategies, and lessons that have propelled these individuals to overcome adversity and achieve success. My aim is to provide actionable insights and real-world advice to help our listeners cultivate their own grit and navigate their personal and professional lives with confidence and resilience. Hello, everyone. Welcome to this week's episode of The Grit Mindset with Matt Rosen. I am your host. Today, I've got a friend, a neighbor, and very successful healthcare executive with me. Her name is Becky Tucker. She is the SVP of Channel Integration at Texas Health Resources. Becky, welcome on The Grit Mindset.
Thanks for having me.
Yeah, it's great to have you. So let's start out by, what are you doing today? Tell us a little bit about what the SVP of Channel Integration role is and what you do for THR.
Sure. So I work for a large nonprofit, faith-based healthcare system in the Dallas-Fort Worth Metroplex. Large institution, so 400 access points, 29 hospitals, multiple physician clinics. And I, as the system vice president of channel integration, actually get to work with all of our channel partners. So all the hospitals, all of our physicians, and all of our ambulatory services. And so I do system operations. So it's a little bit of everything, pretty much.
So how many employees do you have across this organization?
There's 29,000 employees within Texas Health, and I have about 2,000 of those underneath my umbrella of responsibility.
And how many folks do you serve? I imagine it's hundreds of thousands, if not millions.
Yeah, so no, I think we serve about 8 million patients annually. We spread across 16 counties. It's a large footprint within the Dallas-Fort Worth area.
Yeah. That's awesome. So did you wake up one day and say, I want to be a healthcare administrator? Tell us about how this all happened.
Yeah, no, interesting enough, when I was young, I was a competitive gymnast and was injured. And so that was my first, I think, foray into a healthcare environment. And thought it was really fascinating and how to, luckily I wasn't injured too severely, but went through a stint of physical therapy, and that kind of spurred my interest and desire to work in healthcare. Thought I'd be on the clinical side of things, and then was in college, worked for a physician, and really started to like the business side of healthcare. And so that's how that kind of, I guess, came about.
Yeah, so competitive gymnast, that's a tough sport. Tell us just a little bit about that. Did that help get you ready for the career you're going to embark on? Absolutely.
So I grew up in southern New Mexico on a ranch in the middle of nowhere. And as an athlete, actually outgrew the gym that I was in at an early age. So at 11, my parents allowed me to move to Dallas, Texas from Las Cruces, New Mexico, to compete and train in a Texas gym. And I think moving away from parents, living with an aunt and uncle at the age of 11, I have a 13-year-old. I can't imagine having him not around. So, I mean, sometimes I can imagine maybe sending him away, but to be that young and to allow me to do something that I really loved and had a passion for and a drive for, I think set the stage for kind of who I am today. Any competitive athlete, the training, the dedication that goes into it, I think has been really influential in the type of person I am.
Yeah. So how old were you when you got injured?
I was 13. And so then as a teenager, got injured, and gymnastics was no longer my life. It gave me an opportunity not to have to train twice a day, 7 days a week. Was able to go to sleepovers and to the mall and all the other things. And so it opened kind of the idea for me to quit gymnastics and think about doing other things.
But it was that injury that originally got you interested in the whole healthcare field.
Yeah, I was always a healthy child, thankfully, never severely injured. in any capacity, but through that injury had an opportunity to, understand what it was like to be a patient that was going through kind of a healthcare event, and was just fascinated by the ability to make an impact.
Very cool. Well, it's interesting how the early life in that incident helped guide you towards this path. So talk about how you got your start. Obviously, did you go to school for that, or tell us a little bit about how that happened?
Yeah, so I went to school. I'm a kinesiology, biology major, and was really on a path for kind of a clinical field. Did have a desire to go into physical therapy, but as I was working in my physician office throughout college, was introduced into the business side. And there was 2 individuals there that were also working, and they were getting their master's in healthcare administration. And so I learned more about that particular degree and what that, kind of would allow me an opportunity to do. And so after graduating and deciding that, I felt like the business side was more suited for me versus clinical, like taking care of patients day in, day out, I applied to a school here in Dallas, and I have my master's in healthcare administration and my master's in business.
Okay. So you knocked those both out at the same time?
At the same time.
Okay. Yeah, so you got your degree, and then how did you get your first shot working in a hospital?
Sure. So I think those that are interested in healthcare administration often go through what we call a residency program.
Okay.
And my particular school didn't necessarily require one. Actually, we didn't require a residency, but I had friends that have done them and knew that it was an ability for me to enter into kind of the healthcare environment in a different way. But before I did my residency, I was interested in working in hospitals, but I'd never worked in a hospital. I worked in a physician office throughout college, and but never had worked in a hospital. And so I felt like I needed to get my foot in the door, understand if that's truly where I wanted to be. So I took an AA position. I was an administrative assistant at our Texas Health Plano Hospital. It was my very first job within Texas Health. That's about 24 years ago.
Okay.
And so through that work, I was actually in our medical affairs office, which is a department within a hospital that actually does a lot of the business side of how hospitals work and operate. They do the physician credentialing and rules and regs. And so it was a perfect position for me to land in, and it just so happened that's where I landed. Actually, it's kind of funny, and I have told this to our CEO every once in a while, that I was not the first choice for the position. No. So they hired somebody else, and she did not show for new hire orientation. So they called and asked if I was still interested in the position, and I said yes.
So you were like just the backup.
I was a backup. I was second string apparently, and but that was, it was okay. I was fine with it. Got my entry into Texas Health and kind of started my journey with them, understanding how hospitals run. In medical affairs, you work closely with the hospital leadership, so got to know the president at the hospital. And that was really key because he actually helped write a recommendation for me to enter into. Texas Health has a residency and fellowship program for those that are interested in healthcare administration, and was selected as Texas Health's first internal candidate for the program.
Oh, very cool.
Yeah, so I think there were maybe like 94 applicants that year, and there was 2 selected, and I was one of them.
Yeah. Well, it sounds like a lot of things kind of broke the right direction for you early on.
Yes.
Obviously, I've known each other a number of years, and seen a lot of the press over the years. Talk about the path, because you rose through the ranks at a pretty rapid pace.
Yeah, I think, it doesn't feel like a rapid, but yeah, definitely being within the same organization. I say I grew up within Texas Health, and just was very fortunate to, I think, work with some great leaders along the way that saw something in me that allowed me to take on projects that I probably would not have been able to do otherwise, and they trusted in my abilities. And so I've done a lot of new things within Texas Health. In fact, all throughout my 24 years, there's really been only maybe 2 positions that were your traditional kind of roles. All the other roles I've had within Texas Health have actually been brand new roles.
Yeah, can you maybe share some challenges early on of what it meant to step into one of those and figure it out, if you will?
Yeah, so it's, I always think that I don't like to operate in the gray, but apparently I do. Ambiguity seems to find me, but I think it's sometimes challenging because you're forging new paths, and sometimes you're doing things that we haven't done before, and people don't quite understand why we're doing something, or we've always done it this way, and here we are asking for someone to do something a little bit different. But I think that that's been something that set me apart because, I wasn't afraid, I guess, of perhaps, working through those challenges and barriers. One of the very first things that I did within our organizations was work on really the development of what we call kind of our ambulatory strategy. And way back when, it became more, I guess, more important to look at other ways to grow within a healthcare environment, not just your traditional hospital services. And so I got to be a part of a team and lead efforts to develop an ambulatory setting. So we created these neighborhood care and wellness campuses, and a part of them was for us within Texas Health. The very first time we did what we would call a standalone emergency room. Now we see them more prominently,
right.
But 15 years ago that was new for us, and so
you'd have to go to a big hospital, right, if you needed emergency care.
Right, you went to a big hospital. That's how you could seek care. But one of the things that we were looking at doing was how do we bring care closer to individuals that were in kind of more outlying areas. So care closer to home was important to us. And so we had a mindset of building services all outpatient related. And one of them was emergency care. And at that time, we had our emergency physicians who were just amazing physicians. It was a new concept for them. Yeah. And so there was some resistance right up front because they felt like we were going to do something that was not your traditional emergency services. And once we got them on board, it was really a concept that kind of took off for us within the organization. And I was able to really develop 3 campuses across the Metroplex over my time. And that's changed the footprint of Texas Health and the access that those individuals receive in those areas. And so I think that's one of the cool things I've done throughout my career.
That's awesome. Well, you're on the grit mindset. So I ask every guest this: what does grit mean to you, and any stories of grit you can share?
Sure. I mean, I think grit to me is, kind of a fire, or how you kind of go about how you do what you do. And I would say my example that I kind of think through is my father was a rancher.
Yeah.
He was one of 11, grew up in New Mexico on a ranch in New Mexico, worked on a ranch in New Mexico for over 40 years, never took a day off. I think he's probably the definition of grit because it was just I think a purpose, a passion that drove him. And I saw that and just wanted to emulate what and how he kind of attacked his profession. And so for me, it's kind of like who you are, and how you do your work. So
yeah, how did watching him influence how you take on challenges in your daily life at work?
Yeah, no, he. I think one of the things that, besides his strong work ethic, was his ability to listen, and he had, I think, just a really high emotional IQ as well. And so I think some of that came through his ability to listen and kind of be quiet in a moment. And I think that resonates, that he had an ability to connect with people that in a way that I wanted to also do the same. But I think he also he was such a hard worker, right? Like he was up before anybody, and definitely awake a lot later than we were as children. We didn't take any vacations really because you couldn't step away from a ranch. And I think that parlayed very well into healthcare, working in a healthcare environment. It's 24/7, 365 days. And it kind of, I think, set me up for what I've done now for 24 years.
Yeah. No, sounds like she's a great role model. You talked about other role models that kind of helped you up. Anyone you'd like to call out, or stories of those that kind of helped you to get to where you are today?
Yeah, no, I think I've had several along the way. And I would say, I've been drawn to strong female leaders in healthcare. Female leaders are, it's about 20% are within that kind of C-suite, if you will. So knowing that that's where I'd like, where I wanted to go, I was always kind of drawn to really some strong healthcare female leaders. But over, I guess across my journey, there's definitely individuals that have helped shape me at all different levels, which I think is really important too, is that you have to find connections with individuals that I think may have titles. And then there's lots of influential mentors and leaders that I've had along the way that didn't have a title necessarily, but they really showed me what it was to lead and how to lead. Yeah.
No, it's hugely important to have that and to seek and find those role models. So I'd be curious, I'm kind of leading the witness because I know some of the challenging stories from being your neighbor, but would love to hear about what you'd consider maybe one of the grittiest or challenging times you had to overcome during your tenure at THR, and maybe dive into that a little bit.
Yeah. I think that if you were in healthcare within the last, 5 years, COVID is something that really shaped and rocked healthcare in a lot of ways. I would say I was at the time a hospital president. I was over 2 hospitals in Southwest Fort Worth when COVID hit. And, I mentioned I have 2 masters. I have a master's in healthcare, a master's in business. We went through a lot of school, had been in healthcare for a long time. Hospitals plan for lots of different situations, and I would say nothing prepared us for COVID. Yeah. And, I think that when you are leading a team with something that's in front of you that you don't have experience in, it's hard to really know what to say or do or plan, but a lot of that was just met with transparency. So I've shared this story before, but I can vividly remember what it felt like to address my hospital for the very first time as we prepared for COVID. And I might get emotional because it's still one of those things that I think that any healthcare person that went through COVID, it's immensely emotional. So, I was at the time living in Dallas, working in Southwest Fort Worth. So I was already, driving an hour to work. And during COVID, I'd leave my family, and so I've got 2, I've got 2 kids, and at the time that they were much younger, and a husband, and not knowing like what the day was going to be or how, if I would return, was I bringing something home to my family? It was a lot of unknowns that we were, working through, and just a lot of things that we were experiencing that we hadn't seen before emotionally, and people were scared. And so I can remember vividly talking to my healthcare team for the very first time, and just seeing the fear in their eyes. For me, it was just saying, I'm scared. I'm scared too. And I don't know exactly, how, I don't know all the details, but we're going to get it, through it together. And it was really that, I think you could feel grit during that time, because everyone was just doing their best and working tirelessly and just experiencing real, high emotional stress in a lot of ways.
What did you tell yourself, and what did you tell your leaders, other than being transparent? Was there I mean, what do you say to yourself when you get up in the morning to get through a day like that?
Yeah, I mean, there were definitely mornings and days, probably more so on the ride home. And it was really weird and eerie because there was nobody on the road,
no traffic,
right? There was no traffic, which was kind of nice if you were driving an hour each way. But I think for me, it was kind of the decompressing at the end of the day as I was driving home. And there was many times where it was just, I would cry for about 45 minutes. And one of them was, I think, when we were talking through the process in which if we were to not have enough equipment to take care of really sick patients, and how do you start to make the decisions? Because you never go into healthcare. You never want to work in an environment where you can't do what you need to do to save the life of someone, right? That's not why you go into healthcare. And if we were in a situation where we didn't, because at that time, some folks, you didn't have everything. There was limitations on supplies and equipment that was needed because everyone was needing the same type of equipment. And so resources were scarce. And so, it was a very challenging time to kind of think through all of that. But I think what gets you through the day is one another. So, I leaned on closely with my executive leadership team. We all cried together. We did try to celebrate successes. We tried to really do as much as we possibly could to increase morale. And there was a lot of food involved, feeding people and trying to keep people with a little bit of hope. And but it was not something that I would want to repeat, and very glad that we're kind of on the other side.
Yeah, hopefully we don't see that again in our lifetimes.
I hope not. But you know what? There is some positives. I think that we are better positioned now for something like that. Hopefully it will not happen, but I think we're better positioned to take on that type of adversity if we had to.
Yeah. How long were you in that president role over Fort Worth?
So I was at Fort Worth for, I think, about 4 years or so. And it was a real high for me, working in a hospital, amazing people doing amazing things every single day.
Yeah. Now that you're in corporate role overseeing more of the system, any challenging things that you've had to encounter there? Obviously, I don't think anything will stand up to what you went through in COVID.
No, I think for me, I've been in this role now for over 3 years, and I've enjoyed it. It's very different in a lot of ways. But just the challenge of, I think, approaching things at a much higher level from an impact perspective of doing things that potentially could impact the entire organization has been really rewarding, very challenging to do. But, each day is a little, new and different. And I've enjoyed the challenge that this role has brought.
Yeah, very cool. One of the things I always ask, and I think about this with my kids, and I obviously know yours, is what do you think about in instilling grit within them? Because that's something I always struggle with, but I always like to ask guests to figure out what they're doing. Yeah, no, I mean, gosh, I wish I had a magic answer for children. I think it's been really important for me and for my husband, which is to show them by example what it is to really work hard. Yeah. Right. We don't get anything that we have today because it came easy. These are things that we have received because of our hard work, and that's challenging. I think to instill what it means to be grateful and. But for me, it's showing hard work, and that, specifically thinking around women and successful women, I want my daughter to see that, you can succeed as a female within, certain capacities where they think that it's, the sky's the limit. So I think it's working really hard. Yeah. We try to do that. Show that, and then show gratitude. And I think it's really important too to show the importance of
giving back to communities and being really kind of well-rounded.
Yeah, I know you're passionate about. Do you want to talk a little bit about some of the nonprofit work that you do?
Yeah, I mean, I try, time is so limited, right? So I really try to align my extra time with things that I'm passionate about. So most of that's probably connected to some type of healthcare or health related. So I do a lot with the American Heart Association. My daughter was born with a congenital defect, and so heart health has been really important for me, and it's a leading cause for women death. So I've aligned myself with the American Heart Association and do work really for Go Red on the Tarrant County side. And then I'm involved with Leukemia and Lymphoma Society at a former boss who unfortunately passed from lymphoma, and so got connected within that and serve on the board there. Unfortunately, I feel like we all know somebody that has had some type of cancer or blood cancer, and so again, that's some of my passions. And then Brother Bill's is an organization that I know that you know well, and it's I think been so instrumental in our community as a way in which to support those in our community with all the great work they're doing. So I do lots of things, I feel like.
Yeah, it's amazing. You have time to get it all done. And one thing I wanted to go back to that we didn't talk about is, you kind of being a female executive in a fairly male-dominated field. What were some of the challenges you've had to overcome from that aspect? And can you talk about that a little bit?
Yeah, I was thinking about that on the way over, and when I first got to my hospital role, the executive team was really working to secure a stoplight in front of the hospital. They didn't have, it was just a stop sign. And as the community was growing, it was busier and busier, and it was really needed. And so they apparently had been working to secure this stoplight in front of the hospital for quite some time. And so new into my role, set up a meeting with our state representative to talk about the need for this stoplight and for safety, increase in safety. And so I went to City Hall to meet with our representative. And it was myself, and then I had 3 individuals with me. All 3 were males, so I had someone from my executive leadership team, and then there was 2 individuals we were working with on the design of the stoplight and how to navigate through the city and things like that. So we're in a room, and it's myself and these 3 male individuals, and our state rep, who is a male at the time, walked in and introduced himself. And so went up to the first gentleman and said, "Oh, you must be the new president. So nice to meet you." And that individual was part of my executive leadership team. And he said, "No." And he introduced himself. And so then the state rep went to the next individual male and said, "Oh, you must be the next president." And he said, "No." And then went to the third male to say, awkward. Yeah, it was very awkward until, and so I just, I didn't want to step in because for a lot of reasons, but, finally I said no, and I introduced myself as the new president, and we got our stoplight. So I think he felt so bad.
That worked out, right?
So it worked out. But it's those kind of perceptions that, that a female, in a room full of males can perhaps be the individual that was serving in that capacity. And so that kind of lit a little bit of a fire for me at the time, because, I think sometimes we can use that to our advantage, right? So, but those are the sometimes unspoken adversities that we have to do. There's been times when I'm maybe the only female leader in the room. That's changing, which is really great to see. And I think it's really important for me to really promote and support other women leaders, because unfortunately sometimes women are hard cookies to crack. So.
Well, it's great that you're out here doing things like this and sharing your story. So, so is there anything, looking back now, you would tell the younger Becky as you're coming through the ranks?
Oh gosh, I would say there's a couple things, and one of the things that I feel like I've been successful is because I have a village of people that support me. My husband, and I don't know how single parents do what they do.
Yeah.
There's no way that I can do what I'm doing if I didn't have someone that was supporting me at home, and who's been one of my biggest supporters and cheerleaders along the way. We've been married for over 20 years, so he's definitely been there from the very beginning. And so I think it's a village of people. I've got a close group of girlfriends. I think that's really important. We have to be able to connect with folks that are going to lift us up and support us when we need it, and love on us. And that's probably, if I were to tell find your village.
Yeah, I like that. That's great. Well, we're running short on time here. So as we're wrapping up this episode, any final thoughts you'd like to share with our listeners out there?
Yeah, I mean, I love the thought of, resilience and grit. I think the only final thought I would have is that with grit comes grace.
Yeah.
And sometimes we don't often give ourselves grace. I am always a work in progress. And so that's what I would probably say, that I love the grittiness of life, but we really need to balance it with grace.
No, that's a great thought, and I appreciate you sharing that. Well, thank you so much for taking time out of your busy day to come on to the Grit Mindset. Really appreciate your friendship and having you on the show. For our listeners out there, hopefully you took something great away from Becky's story. And for this week's episode of the Grit Mindset, this is your host, Matt Rosen, signing out. Stay gritty out there.